Isaac Asimov, a prolific author on various subjects relating to science, once stated, "Life is pleasant, death is peaceful. It's the transition that's troublesome." It is well established that those afflicted with terminal illnesses will suffer more than we could possibly understand. So maybe this is why, for a lack of empathy, that the terminally ill have been allowed to suffer so greatly, to lose control of their own lives, and to feel as if a burden on society. And these sufferers of terminal illnesses are the only ones who will be given the option for euthanasia. Those with terminal cancer, AIDS, or motor neuron diseases such as ALS will have the opportunity for either a lethal dosage of barbiturates or a lethal injection. A person considering euthanasia will first go before a doctor at a local hospital, requesting euthanasia. The doctor will inform this person of alternatives, as well as referring them to psychiatric help. After a 1-month waiting period, the person, if still interested in euthanasia, must go before a small committee including doctors as well as psychologists, and convince them that their desire is sincere and not simply on a whim. If the person is under 18 or a non-citizen of the United States, they will be immediately turned away. If approved, the person's family will be notified. Another 2-week waiting period will follow, in which the person can further contemplate their decision, as well as consult their family. However, ultimately, the decision is left to the patient. Then, if the patient still desires it, the doctor they initially met with will administer euthanasia, though none will ever be required to do so. After the euthanasia is completed, the act will be reported to local police, who will then investigate to ensure proper protocol was abided by throughout the entire process. If the investigation shows otherwise, the doctor who performed the euthanasia will lose their license to practice. There is simply no room for error. Euthanasia will be administered orally via a prescription of barbiturates given only under the presence of a doctor. However, if the patient is incapable of swallowing the dosage, the euthanasia will be given with a lethal injection. The injection will begin with an intravenous administration of a small volume of thiopental sodium, which will bring the patient into a coma, ensuring they will feel no pain. Then, the patient will be given a triple dose of a neuromuscular relaxant, which will end the process. The patient will die without pain, and they will die with their dignity intact. If a person falls into a persistent vegetative state, life support will not be withheld unless specifically stated in a living will. However, life support will never be withheld in the case of simply a coma. Thus, those who suffer both physically and mentally from terminal illnesses can end their suffering in a humane way. Now, the negative may argue that terminal illnesses cause physical pain which can be treated with medication. And this is true. However, there is far more to a terminal illness than simply the physical pain. In fact, in an article published by the Chicago Tribune, it was stated, and I quote, "Depression, hopelessness, and fear of becoming a burden are primary reasons why critically ill patients consider suicide, experts confirmed. Surprisingly, pain is a less important factor." Some will also say that this will result in certain more vulnerable groups, such as those who are elderly, uninsured, or minorities, dying in elevated rates. A study by the University of Utah and Oregon and the Netherlands proved otherwise. The vulnerable groups did not use euthanasia at elevated rates, thus proving that euthanasia does not cause disproportionate numbers of deaths, but it does allow those who wish to die and may find alternatives, if not given the opportunity, to do so humanely. A principle of American philosophy is freedom. The idea that a person can do anything with their life that they please. So, if we have such freedom with our lives, why then do we lose these freedoms when it comes to our deaths? It is simply not the role of our government to intervene and decide for someone suffering from a terminal illness that they do not have the right to die on their own terms. Euthanasia will also relieve the expensive burden of medication that only prolongs a life which a person does not necessarily wish to live. AIDS patients pay upwards of $25,000 a year. Cancer treatments cost a family $100,000 a year. And motor neuron diseases such as ALS can reach a staggering $200,000 every year. As it stands, the only way for such people to end their lives are by either ceasing to take medication and thus suffering even further, or committing suicide, both of which are not only inhumane, but have a deeper impact on friends and family. The negative may argue this last point is invalid, as euthanasia is in essence suicide, but it is not the same. Euthanasia allows someone to end their suffering with dignity. Imagine for a moment entering your home after a day at school, work, whatever it may be. Imagine calling out as you enter the door to a parent, a sibling, a loved one. Imagine no answer. You enter into your living room, finding your parent, sibling, loved one, lying dead on the floor, a gun in their hand, blood spattered across the wall. Imagine them dangling from a ceiling fan, swaying slowly side to side, a red ring around their neck. And tell me that suicide and euthanasia are the same. When a person truly wishes to die, there is nothing we can do to stop them. We can only hope to give them a passing that is both peaceful and dignified. Thank you. Vote affirmative.